Hey guys, this is Manu Kalia, physical therapist and Ayurveda herbalist. So this video I'm going to talk to you guys about patellofemoral problems. And this is based on a lot of the questions you guys have asked me about knee-related issues and specifically patellofemoral problems. And I've had this question come from a lot of the runners too, and other athletes. So I wanted to kind of go over the patellofemoral joint and then also discuss some of the common structures that are responsible for getting the patellofemoral joint in trouble. So just to go over the basic anatomy first. So the patella is your kneecap, and the patellofemoral joint is the joint that's created by your kneecap with your thigh bone, which is the femur, and it sits in the groove. Okay, so your patellar tendon is just below that kneecap, tip of the kneecap. So here's the top of the kneecap, here's the tip of the kneecap. Just below that is your patellar tendon that sits this way, lengthwise. All right. So a lot of the patellofemoral problems that people are having, the common presentations are going to be pain along either the inside part of the patella, the kneecap through here, along this border. It could be on the outside part of the border, so basically along this region. You could also have referral, of course, coming further down into the knee and along the patellar tendon itself. Can have a lot of times pain along the outside or lateral border. And then, of course, radiating pain coming into different regions of the knee too. And at times, the kneecap, the patella, if there's too much grinding going on with the patellofemoral joint, and another name for that is the chondromalacia patella, which is basically softening of the bone or the cartilage underneath the kneecap. Okay, and that can also refer pain sometimes in the back of the knee too. So, it's important obviously to treat the problem itself, but you got to make sure you get rid of the cause of the problems. So if there are mechanical issues that are taking place that are predisposing or getting the person into a position or a place where the kneecaps, the joints getting irritated, that's going to get you in trouble too. If you don't take care of those problems, this problem is going to continue. Okay, so I put up some videos in the past on cross-friction massage of the patellar tendon and along the kneecap. You can refer to those videos in terms of some of the treatment ideas. And also on my site I have a bunch of stuff too. So in terms of mechanical things that could be predisposing or getting you in trouble or changing the alignment of the patellar tendon or the patellofemoral joint or increasing the sensitivity of the tissue, below the joint you want to always look above and below the joint. So below the joint is your foot. So mechanics at the foot. So if I have, for example, if I have flat feet, if the arch collapses down, it goes downwards, there's not enough support through here, you can see how as the arch goes down, it rotates my tibia inwards a bit. And that's going to change what happens at the knee too, and actually all the way up the chain. So you might have to look at if there's not adequate support, you have flat feet, whether I need to support the arch a little bit better to take some of the load off on the inside of the knee as well as the patella or the patellar tendon. So mechanically what's happening at the foot is also important. So flat feet is one issue. You could also have, of course, a high arch, a rigid foot, and that could also be changing things at the joint too. So it affects what happens up the chain. So really take a look at what's happening at the foot, all right? Whether there's stiffness, whether there's too much mobility, too much laxity, and that doesn't make for a stable foot. So when you're running and doing higher level activities, the impact, that load that's placed on the foot is not transmitted properly up the chain, okay? Or there's more load going up the chain. So the second thing to think about is above the joint. So now here we're talking about your hip. So if the hip is tight, okay, so if there's a tightness of your internal rotators, the hip capsule is tight, or you have weakness of your glutes, which is quite common. So your gluteus maximus and gluteus medius, right, which stabilize your pelvis. And also your gluteus maximus is, in addition to being a good, important extensor of the hip, it also does external rotation of the hip. So that stabilizes your pelvis and also externally rotates the hip in this position. So internal rotation is going inwards. So if my hip is collapsing inwards, you can see how that again is going to impact what happens at the kneecap too, and down the chain. Okay? So this is just in a static position when the person is standing right here. Now think about it, if you're running or doing high level activities and you have so much force going through the system, how that's going to affect things if the hip is too tight or if the glutes are too weak, right? That's going to affect the pelvis and down the chain too. So internal rotation taking place here, will again increase that load through that patellar tendon as well as the patellofemoral joint, will change the mechanics of the joint. So these things can definitely affect what happens at this joint too. So for those of you who are runners or athletes or just anyone who's suffering from this problem, really think about what happens at the hip, the pelvis, at the foot, so above and below the joint. Really pay attention to those structures also. And then of course you got to treat locally too. So keep those questions coming, and I'm happy to hear from you guys. And if you have specific topics you want me to go over, leave a comment, and you can always shoot me an email, and make sure you subscribe to the channel. Thanks.